Hello, my name is Mandy Anderson. I'm an MSW student with the University of Washington here in Tacoma, and I'm presenting my 2022 capstone project. For the past 5 years, I have been working with the treatment team serving clients who are enrolled in Felony Mental Health Court with an 18-month diversion program in Pierce County, Washington. The purpose of my capstone project is to reduce or close the gap in services clients experience after graduating from the Felony Mental Health Court program by creating an aftercare position for the Forensic Assertive Community Treatment Team, or the FACT team. Diversion programs like Felony Mental Health Court aim to reduce the number of stays clients have in hospital, emergency departments, psychiatric hospitals, and jails, as well as reducing recidivism by focusing treatment on the development of life skills that can further independence in the community. Some of the services that are currently provided by the treatment team include a full-time nurse to assist with scheduling medical appointments and medication management. Often clients coming into the Felony Mental Health Court program have struggled with medication compliance, impacting their ability to live independently. The team has full-time therapists that provide evidence-based treatment, such as cognitive behavioral therapy, dialectical behavioral therapy, motivational interviewing, and client-centered therapy. Peer supporters are really the backbone of this treatment team, meeting clients in the community and providing support and empowerment through their lived experience. Currently, the FACT team provides wraparound care to clients as part of their participation in Felony Mental Health Court. However, when the client completes the program, they are often only minimally connected to services outside the FACT treatment team. For example, the client may have been participating in regular visits with their primary care doctor while in the mental health court program. But when the client begins to decompensate, experiencing an increase in symptoms associated with their mental health, other barriers to successful transitions after completing Felony Mental Health Court include issues with housing stability. At the time of graduation, the client is required to be in independent housing that supports their transition out of felony mental health care. However, clients who experience a fluctuation in symptoms associated with their mental health may struggle to have positive relationships with housemates and may become a burden to the housing managers, resulting in eviction. When clients are experiencing homelessness or an increase in symptoms, they often find themselves back where they started before participating in mental health court. An aftercare position on the treatment team can provide support to these clients when they need it. The individual in the position will be familiar to the client since they would have been working with them relatively closely over the past 18 months of their regular participation in mental health court. This position can be filled by a peer case manager who has lived experience and can support the continued development of an individual's daily living skills, as well as provide support when needed at medical appointments, assist with medication management, and work as a liaison to promote housing stability. Peers utilize evidence-based treatment models that focus on empowerment of the individual, further developing natural supports by connecting the client with resources in the community, such as 12-step recovery programs and support groups. Funding this position would mean requesting an expansion of the current contract through Beacon and utilizing Greater Lakes mental health care grant writers. Outcomes can be measured by utilizing case notes and surveys that would be collected from participants quarterly to determine current needs as well as needs that have been met with the support of the aftercare professional. Assertive community treatment teams like the FACT team thrive when the members are able to evaluate the needs of the participants and make changes to accommodate those needs. Over the past 5 years, graduates of Felony Mental Health Court have struggled to transition from the intensive treatment program to full independence, resulting in incarceration, visits to hospital emergency departments, and stays in psychiatric hospitals. Adding an aftercare position to the FACT treatment team will help to close the gap these individuals are experiencing in services.